Good morning, doctors. Welcome again. Today we are going to discuss about UPSC CMS paper 2013, part 1, its B section. In a right-handed person, which of the following sign is not characteristic feature of occlusion in a right middle cerebral artery, that is left hemiplegia with aphasia? So B option is right, and why? In the right-handed person, the speech area lies in the left cerebral hemisphere. According to the Harrison Language Network, show the left hemisphere dominance pattern in the vast majority of population is approximately 90% of right-handed and 60% in left-handers. Aphasia occurs only after lesion of left hemisphere. In some individuals, no hemispheric dominance for language can be discerned, and in some others, include a small minority of right-handed, there is right hemisphere dominance for language. Okay, metaclopramide suppresses which of the following neurotransmitter in vomiting? It suppresses means antagonized dopamine, and if serotonin 5-HT4, it's agonist activity. So answer is A. Now the amyloid protein in a primary systematic amyloidosis belongs to which of the following class of fibril proteins is AL proteins? Okay, B option is right. Now match the following. Which one is true? Code alpha 2 beta 2 is hemoglobin A. So A option is second answer. So we see C and D similar to this. Alpha 2 and gamma 2 is for hemoglobin F. Alpha 2 and gamma 2 C hemoglobin F. So B is third. So D option is fitting here. Alpha 2 delta 2 is hemoglobin A2, C 1D C, and BR beta 2 is hemoglobin H. So D option is the right. Okay. Now, which of the following is not a common feature of cystic fibrosis? Exocrine pancreatic insufficiency there, yes. Azoospermia, yes. Distal gastrointestinal obstruction, yes. But there is no polyneuropathy. In cystic fibrosis is characterized by chronic bacterial infection in the airways. It leads bronchitis, bronchiectasis, exocrine pancreatic insufficiency, intestinal dysfunction, abnormal sweat gland function, and urogenital disinfection. So this is it. A 60-year-old male suffering from auditory hallucinations says the people staying upstairs were talking about him and conspiring against him. He filed a police complaint against them, but the allegations were proved to be wrong. The most likely diagnosis here is schizophrenia. Okay. The patient is suffering from schizophrenia. A given history very short, but it gives us two important features. First, auditory hallucination. As we know in schizophrenia, auditory hallucination third person is most common. This is characteristic feature of schizophrenia. It is 74% we see in. Second, delusion persecution seen 65% of patient. These two features together towards schizophrenia. Okay, each of the following is true about the idiopathic primary pulmonary hypertension except it is usually associated with CAD, it's coronary artery disease. This is wrong. It is more common in female. It is asymptomatic to begin with, characterized by autosomal dominance inheritance. Yes. Now, which of the following is not correct about Wilson disease? It's an autosomal recessive disorder. Yes. Low serum ceruloplasmin. Yes. There is hepatolenticular degeneration. Yes. But serum copper concentration is high. This is false. So these are right answer. Now, which of the following is not a etiology of transductive pleural effusion? Transductive, it's mesothelioma, it's not a transudative pleural effusion. Okay. Now, with reference to secondary tumors of the lung, which one of the following is not correct? Diagnosis made by radiological examination. Yes. Endobronchial deposits are common. So this is wrong. This are usually multiple and bilateral. Yes. Quite often there are no respiratory symptoms. Yes. So B option is the right. They are asking except. So B is the right. So guys, have a good day. Goodbye. That's all for today. Hope you like this video. If you have any queries, any comments, you can ask me. And if you still not subscribe my channel, subscribe it. Thank you. Good day.